Thank you, Mr. Chair, and thank you, everybody, ladies and gentlemen, for being here tonight. The WRH team members, as well as representatives from the Foundation and the auxiliary, thank you for being here, and thank you for your hours of volunteerism to help support Windsor Regional Hospital. And we couldn't do it without you, and Faye, we're going to make sure you are going to be involved in the design and be there to welcome the new gift shop at the new hospital, so we look forward to it for sure. So needless to say, this past year has been a roller coaster ride for all of us, and but we made it through. We made it through the year. And the one thing I carry, some of you might know, is I carry this paperweight with me, and it's a quote from Winston Churchill, and it says, "If you're going through hell, keep going." And I've had this for a handful of decades. So we kept going for sure this past year, and we're on the other side of it right now. So it's been a difficult year through COVID-19, and it really held a grip on us, but we were able to loosen that grip, and as I stated, having our beloved volunteers return was a great day for Windsor Regional Hospital, and to have them back in this building was fantastic. And for all of us, it was clearly a breath of fresh air, and I say that literally and figuratively because we loosened up our mask restrictions and we took advantage of that. Our challenges remain, though, in the system, not only here at Windsor Regional Hospital, but across the system, with respect to increased patient volumes, with respect to surgical backlogs. But we're not alone in this battle, and our provincial government has been there, is committed to transitioning the healthcare system into an era of stability. And right now, the word stability is a very fulfilling word that hopefully we can get to that point, and we can have some stability moving forward, but we're getting closer. You can feel it. Innovation's been phenomenal for this past year. With respect to the various innovation, we've been able to upgrade, even though in the middle of the pandemic, we talked about doubling the number of MRIs from 2 to 4 in Windsor Essex and 2 to 3 here. At the same time, you know, we had Premier Ford come and visit us and announce the $30 million investment in our cardiac cath lab, moving it from the basement up into one of the floors. The new radiation bunker's on its way as well. Also, we partnered with the Windsor Surgical Center to take care of cataracts and deal with the wait list and cataract surgeries that could have been atrocious, but for the partnership that started at the start of COVID and continues through today. We have some of the shortest wait lists across the whole province. We had the EVR surgery, the ultrasound machine surgery. We started doing surgery with robots on hips. So we've made a lot of advancements, and that was through the support and contribution of our Windsor Essex community and our foundation and our auxiliary to make those things happen. Is to pay for all that equipment is very positive. At the same time, we have to focus on our staff, and we were able to relaunch and reinvigorate our workplace wellness program. We offer things from cooking to kayaking, from yoga to kickboxing, and it's been very positive. Thousands of staff have participated in it, to the point some of the events sell out, which is great to hear, but a lot of activity and a lot of positive feedback with respect to that, and that'll continue to grow. At the same time, we've been able to use and work with our government in order to support the recruitment and retention of nurses, allied health professionals, professional staff, and other frontline staff through things like externs, the CCPN program, supervised practice experience partnerships. And we've been able to introduce hundreds of new staff to this organization over the last year. And then our grand plan, and that's planning for the new Windsor-Essex Acute Care Hospital. That's ongoing right now. We're going to be going to RFP in 2025. It's going to happen a lot sooner than we think, in the sense of it's going to be upon us very fast. That is not that way, folks. In 2026, a shovel in the ground. So we got a ton of work to do between now and then, but it's some exciting work that everyone has rallied around to make it a reality. And the one thing COVID did show us is the desperate need. There was a desperate need before, I don't know what the word is now, but it's beyond desperate need for a new acute care hospital. So that's going to be upon us. And, you know, at the same time, we had community representatives involved in the planning process. They're going to continue to be there. Our First Nation communities have been involved in the process. Pretty exciting. The proposals we've put forward to the government with our First Nation partners, and look forward to that site and the excellence that's going to be there with respect to our patients and our community. So, you know, what do we got looking forward into the future? I mean, some of the things we put together, we have a great relationship with the Windsor Police Services. We've been able to put together some programs really recently meaning in the last 6-8 months with them, where we were having issues where police officers had to stay in the emergency department before they could transfer care to our staff. The police came forward and said, you know what, let's put a dedicated police officer in the emergency department who can help with that handoff and be there and be responsible for more than one patient, and then be able to transfer that. Our transfer times went from 6 hours, 7 hours on average. Now it's 30 minutes on average. Other organizations, other police departments are taking notice, and they're wanting to come down to Windsor and see what's going on in Windsor to model that across the province. So it's something unique. Literally, we talked about it in advance of Christmas. We had it up and running January 1st. And then most recently with our nurse and police teams, having the staff go out, our nursing staff go out with police on Friday, Saturdays, and Sunday evenings, or afternoons and evenings from 11 to 11 right now, and take care of individuals on the street where they live, and taking care of their health care needs, trying to avoid them having to use the emergency department. So try to proactively address their needs on the street and not wait until the need becomes so severe that they have to come to the emergency department. They've seen hundreds of individuals so far, have avoided a large amount of emergency visits already. What we clearly realize, and which we knew going in, that's why we picked Friday, Saturday, Sunday nights, is that's our busiest nights. And those hours are the busiest hours, is that as a healthcare community, we have to recognize the mental health and addictions populations, their needs, and what we have to take care of them for has changed dramatically over the last decade. And I can't, use the words banker hours, because that's an insult to bankers now, because bankers are open later in the evening and on weekends. Is we have to recognize we have to have these services available later in the evening into the weekends for these individuals to help them. And that's the only way we're going to get through this. I even heard on the radio this morning, they talked about housing, and they said housing is just one solution. If you provide housing, but you don't provide the support they need in a timely fashion, you can provide all the housing you want. It's just going to revert back to where they came from. So it's how can we help them? So that's been very popular, and I know our community partners are coming on board and really excited about it and talking about, okay, we have to change our services in order to accommodate this need. So it's something very exciting. The work Dr. Saad's doing with the research opportunities, talking about it with respect to the Office of Research, and it's resulted in some great innovation, discovery, and excellence. So it's some very positive things on the horizon with respect to Windsor Essex, and with respect to our healthcare community, and with respect to Windsor Regional Hospital. Clearly, we've weathered a tough storm, but really we've emerged stronger than ever. And the future looks very bright for Windsor Regional Hospital and our community. It's going to take a lot of work, but the great thing about it is my executive team members, got Dr. Sod, Karen, Rosemary, Jonathan, Teresa, Melissa, Margot, Todd, and our newest member, Brandon. They clearly can do this because we just recently did a research study that we all participated in. And one of the questions in the research study, it was examining executive committee members coming out of COVID and things that have changed, and for everyone to provide feedback with respect to that. And we're one of, I don't know, 140 hospitals or institutions that participated in it. So it was a good sample survey size. The one question I want to highlight regarding our team, the question was, based on your definition of burnout, how would you rate your level of burnout? And a higher score indicates a higher level of burnout. Well, our team, not me, and I'll explain, scored 2 out of 5. We were in the lowest 25th percentile. So clearly, our senior team has a lot more gas in the tank or electricity in the tank to take care of the issues in front of us. By the way, I scored 5 on that. So for us to score 2, the lowest out of all of the survey participants. So I was shocked when I saw that answer. I was like, ooh, all right, let's go. So good show. You guys can carry me the rest of the way. So to our board of directors, this has been the first time we've talked about this. We've been together since 2020. However, just because of that, clearly you folks have done a ton of work, and we couldn't have gotten through what we went through without you. And you were there to support us in every which way you could, and every single proposal or idea or concept it was like, okay, let's do it, let's try it, let's make it. Going back to the day, if you remember, because I remember, back in like it was April of 2020, coming forward and saying, listen, I got a lead on some N95 masks in China, but I need $5 million to send to some guy I've never met. But he needs it in his pocket so he can purchase these masks on the street from these companies. And sure enough, the board said, yeah, let's do it. And we did it, and it worked out. But that's kind of what the types of things we had to do, and we got it done. So, you know, in the last 3 years, congratulations, you got your box lunch. So that's your gift for your donation of time for the last 3 years. And anyone listening in the community right now, no, board members are not paid, they're volunteers. So they volunteer all their time. And they provide, and not to scare anybody off because we have applications out for committee members, so it's really easy. But thank you for all the time that the board members commit. Anthony, you've provided 3 years of amazing leadership. And, you know, every single chair I have, I keep thinking that, oh, it's going to be easier for them. And sure enough, in your case, it wasn't even close. And you inherited the most difficult time out of everybody, and I thought that was impossible. Thank you for your guidance. Literally, if we weren't laughing, we were crying for the last 3 years. It was tough, but thank you. And I know, yep. And that's, Anthony has a full-time job, of course. So he had to deal with all of that and then be available to deal with us and deal with the issues and being involved in regular conversations regarding issues. So not to scare you, Patty, because, yes. But it's going to be better, Patty. Trust me, the next 2 years got to be better. How can it be worse? So really, but no, but look forward to working with you, Patty, and your leadership. And heck, you've been through this before, so this is easy for you. So, but thank you for stepping forward as chair. And to our Windsor-Essex community, thank you for being there for us. You saw the donation amounts. That's just a piece of the action. Just the support you give our staff and our community is amazing, and Windsor-Essex is there. And we wouldn't be pushing that, we wouldn't be sticking a shovel in the ground in 2026 if it wasn't for the community's dedication and the province hearing loud and clear from our community that it was a priority to get that hospital built. And they hear it on a regular basis. So they know it and it's going to happen. So we really want to thank the Windsor-Essex community. So when we embark on 23-24, we got to remember that our challenges are really just opportunities in disguise. And together, we're going to continue to build a brighter, healthier future for Windsor-Essex and for Windsor Regional Hospital. We're all going to do it together. So thank you, everybody, for all your support and all your help. You've done an amazing job, and to a great year coming up. Thank you.